Welcome everyone to this segment for today. So for those of you who don't know me, my name is Lisa Douglas and my profession is that of a nurse. I do a lot of education. I'm very big on education and missions. And so this is one of the reasons why we've started these tapings and these different sessions speaking to physicians as well as other professionals. I have done a teaching already with a Dr. Brian Swan on oral care. And all these sessions are available for you to view on my YouTube channel, which is Nurse Lisa Douglas. It is open for anyone to look at and to view, ask any questions, have comments, any ideas of what you like to see or hear about. You can also leave those comments for me. The reason why I started this channel is primarily because in doing medical missions, it becomes difficult to travel back to Jamaica on a yearly basis. And so this avenue have allowed me to be able to reach a lot of people and be able to educate them. But no man is an island. I don't know everything. And so I seek the guidance and the wisdom of other professionals, one of whom we have the pleasure of having with us today, and that is Dr. Joel Wright. And so I'm going to tell you a little bit about his background. So Dr. Joel Wright was born and raised in Kingston, Jamaica. So he's a homeboy right out of Jamaica. I'm very proud of him. He graduated in 2016 from the University of the West Indies with honors in the Bachelor of Medicine, Bachelor of Surgery program. He then completed his internship at the Kingston Public Hospital and spent the following year between the Greater Portmore Health Center, Kingston Public Hospital, and the National Chest Hospital, where he worked in general medicine, dermatology, and rheumatology. He completed a year of specialization in internal medicine at the University of the West Indies before leaving to work in general practice at El Shaddai Medical Center in Kingston, Jamaica. He then moved to the United States to continue specialization in internal medicine, where he currently works as a physician at Englewood Hospital in New Jersey, where I also work as a nurse manager. He is very passionate about diagnosing and treating autoimmune disorders and intends to subspecialize in rheumatology following his internal medicine residency. While in Jamaica, he was an active member of the Lupus Foundation of Jamaica. Outside of medicine, he's an avid runner, something I need to learn to do every day, and enjoys playing the saxophone and the cello. Ladies and gentlemen, it is with great pleasure and honor that I introduce to you this lovely, bright, intelligent young man who is very passionate about something that I'm very passionate about as well, not only educating the community, but on the topic of rheumatology. Please welcome Dr. Joel Wright.
Hello, hi, thank you for having me. Thank you for the introduction. So without further ado, I'll just get started. Let me just share the screen now. Okay, great. Let's start. Lisa asked me to talk about lupus today. May is Lupus Awareness Month, as well as Arthritis Awareness Month too. I think it's one of those diseases that you hear about oftentimes, but many people don't really have an idea or understanding of what it is. Is it cancer? Is it contagious? What is it? I have this picture up here because lupus is also known as the disease of 1,000 faces. And lupus really is a disease of the immune system where your body is unable to recognize and protect itself. And because of that, it ends up destroying itself. An easy way that I used to think about it is the fact that each cell in your body has a little name tag on it that says your name. Every cell in my body has my name on it. It says Joel Wright. Do not trouble. This is him. Leave it alone. This is fine. He belongs in here. All of these cells. When you do have a virus, viral or a bacterial infection, viruses and bacteria, they don't have your name tag on them. So your body says, this looks foreign. I don't recognize this. So then it begins to kill the viruses and the bacteria. We're very grateful to our immune systems for doing that. In a person with lupus, unfortunately, their body does not recognize their own name tags. So it sees every cell in their body as foreign. And if it sees these cells as foreign, then it's going to try and destroy them. So that's essentially what happens in lupus. Your immune system does not recognize your body and in turn ends up destroying your own body, really. So a bit of its history. Lupus actually means wolf in Latin, and there are many reasons why they thought that they would give that analogy to a wolf. As you can see the picture on the left side, I suppose back in the olden days they thought that that rash that sometimes is very characteristic of lupus resembled a wolf's bite. Wolves are also known to be violent and unpredictable, and that's really the course of lupus. Also, lupus can be a very violent and unpredictable disease, and its name lupus, which means wolf in Latin. So who does lupus affect? So there are approximately 6,000 persons in Jamaica currently living with lupus. And the Lupus Foundation of America estimates 1.5 million cases of lupus in the USA. Every number that you will see is definitely going to be grossly underreported because there are many people living with lupus who don't even know that they have lupus. The frequency varies by race, with Blacks and Hispanics being the most affected. So they're the most affected, and unfortunately, they're also the most severely affected also. Lupus affects women 9 times more than men, with the average age of onset being around in the mid-20s. So right at that point in life, when you're trying to finish up school, start a career, start a family, that's, you're at childbearing age, that's the point that lupus decides that it's going to strike. And children may also develop lupus. So again, it's a disease of 1,000 faces. It doesn't spare any race, any gender, any age. Anybody can develop lupus. What makes somebody more susceptible, or what puts a person at risk of developing lupus? There are many, many different things, and I will start with genetics. It's very rare that you'll have one gene that will say, okay, this person is going to develop lupus, and boom, they have lupus. But it's really, multiple different things together that play a role in a person developing lupus. So we call it the perfect storm, in the right person with certain genetics. With hormonal exposure, we think that estrogen is a hormone that stimulates the immune system. Hence, women are more likely to develop lupus. There are environmental factors also, like being exposed to viruses early in childhood, a virus known as EBV, cigarette smoke, mercury, silica dust, and even certain medications can precipitate lupus. The thing with medications, though, is that after the medications are withdrawn, usually the lupus-like syndrome disappears. I was alluding to the fact that, it's what we call the perfect storm. So it's multiple of these different things, genetics with hormones, environmental factors. I need to even add stress there, that precipitates someone to developing lupus. Many times you'll hear patients say, everything was going fine until, I just had the flu one day and then, the lupus developed, or, I was okay until I went to the beach, I was in the sun the whole day, and then, the lupus developed, or everything was okay, and, exam season was coming around, I was under a lot of stress, under a lot of pressure, and then. So multiple of these factors predispose someone to developing lupus. I will say, though, that genetics does play a big part. If you do have a family member, a first-degree family member with lupus, you're like 20 times more likely to develop lupus or some other autoimmune disorder. And autoimmune just means similarly to lupus, where the body destroys itself. There are different types of lupus. It falls generally under 2 categories. There is lupus that affects the skin. We call it cutaneous lupus. And generally, when people talk about lupus, what they really mean is systemic lupus erythematosus, or SLE, or just plain old lupus, which affects multiple parts of the body. So the signs and symptoms of lupus, it's all encompassing. I don't think any system in the body is spared. And it kind of makes sense, as I mentioned earlier, the fact that, your body is unable to recognize its own cells. And since we have cells everywhere, it's kind of a given that lupus can affect every system. So some of the common signs and symptoms of lupus are, just an unexplained fever, just fever for a week, 2 weeks, 3 weeks, just not going away. It might come in the evening and then you're fine again, but you realize you're just not getting rid of this fever with, just weight loss and just changes in appetite. Persons have chronic fatigue, so they're just tired all the time. It's unexplainable. And it's another reason that lupus is called an invisible disease. There's so many things going on inside of the person. They're just tired, and you can't see anything physically on the outside, but there's so much going on the inside, so much inflammation. Going from head to toe, neurologically, they can have, when lupus affects the brain, you can have psychosis. So they may look like they have schizophrenia, right? Or even bipolar disease. They can have depression as a result of lupus, seizures as a result of lupus, just even memory impairments, just difficulty remembering things, a little brain fog, you just can't have, you're just having difficulty focusing and just concentrating. Lupus can also affect the spinal cord, causing weakness to the legs, affects the nerves, numbness and weakness to the fingers and to the feet. Affects the skin. Very characteristically, they get a little rash across the face called the butterfly rash, or the malar rash. Lupus can cause ulcers in the mouth, in the nostrils. Lupus affects the heart, all layers of the heart. It can affect the muscle of the heart, the lining of the heart, causing fluid to build up on the outside of the heart. Can cause heart failure, can cause clots, blood clots in the blood vessels. Anywhere you have blood vessels, you can have these clots, in the brain, in the arms, in the legs, anywhere. Other skin changes, and I'll go through, just another slide with other pictures of different rashes that persons with lupus can get. They can get arthritis, so their joints become swollen, painful, red, The gastrointestinal tract is also involved. They can have pancreatitis, they can have swelling of the abdomen. All sorts of things can go wrong in lupus. It doesn't spare any system at all. This is a picture of the malar rash. The picture on the left is a guy, and the rash that comes across the face like that, sometimes it can be pretty subtle. It's probably a little subtle in his case, this may look like a little bit like eczema, or it can be a little more extensive or severe as the guy on the right side. And again, as I've mentioned earlier, in persons of color, it tends to be a little bit more or a lot more severe. Other rashes or things on the skin that are associated with lupus. This is actually a picture of a patient that I saw in Jamaica just a few months before I actually came up to New Jersey. I was working in a private office at El Shaddai Medical Center. She was at KPH, the Kingston Public Hospital, previously for like 2 weeks, just admitted with fever, on and off joint pain, nausea, vomiting, diarrhea, abdominal pain, and just a little bit of fluid in the belly. They weren't really quite sure what the cause was at the time, but gave her some painkillers, antibiotics. She felt a little better. So they said, if you start to feel worse, just come back to the hospital, I guess, to figure it out. Unfortunately, she didn't return to the hospital. She came to the private office, and I was kind of like, I don't really know if I can help you. They have all the records at the hospital. It sounds like something that, needs a lot of investigation. Just really asking a lot of questions and doing a thorough examination. There and then I was able to say, I think you have lupus. This young 20-year-old girl in university, her fingers at the time that I had seen her, you see these red spots at the tips of the fingers right here, blood vessels being destroyed by the immune system along here. Very, very, very subtle. So it's so important to take a good history and a very thorough examination. Also, you can see these, it almost looks like scabs, right? It almost looks like something cutter, but these are characteristic rashes also, very subtle that we see in lupus. So I just called the rheumatologist that I had known, and I said, I think this girl has lupus. She's having fever. She has joint pain that comes and goes. She has fluid in the tummy. She has these findings on her skin that I think may be lupus. The rheumatologist said, we'll send her to the clinic and I'll see her next week. By the time she got to the clinic next week, she started to get these ulcers now around the nostrils, right? So this is very, very, very early lupus, and thank God we caught it early. This is Seal Hassinger. He also has lupus. So these here on the skin is what we call discoid lupus, a kind of rash that you can get with lupus. And these scars here, the same exact thing that's going on here on this young girl's elbow. Another thing that they can get can be very frightening, Raynaud's phenomenon, where the blood vessels in the tips of the fingers just get constricted, or they get a little tight when the time is cold. And so they're very painful. They become pale, then they become blue, then they become red. So how do we make the diagnosis of lupus? Making the diagnosis can be very difficult. And, for many people, it takes unfortunately weeks to months to even years before a diagnosis can be made. Sometimes the symptoms start and they go away by themselves. You say, well, that was weird. And then 3 months later, you notice something else again, you notice a rash, and then it goes away. 4 months later, you notice your legs swelling, you're just like, what's going on? So sometimes that can, cause a delay in symptoms. Symptoms can also be pretty vague and just non-specific. You go to the doctor sometimes, you're like, well, it could be a flu, it could be a cold, because it resembles so many other diseases, But really we make the diagnosis by going to a doctor who can identify the signs and symptoms that I had listed earlier before, in conjunction with blood tests, looking at the blood counts, your red blood cells, your platelets, your white blood cells, because lupus can also make all of these counts low. It can cause anemia, low blood counts. Looking at the kidney function, the urine test, and really antibodies, these antibodies are these proteins that are doing the job of destroying the body. If a person has a rash on the skin, or if you think they have involvement of their kidneys, you can always take a piece of the tissue, do a biopsy, and that can help to clue you into the diagnosis. The treatment of lupus, unfortunately, it can't be cured, but it can be controlled. Just like with I actually wanted to mention, sorry, before I get there, again, it's difficult to make the diagnosis of lupus because you have to look for all of these different things, what the patient tells you, what you find on examination, what you see in the blood tests. And it's not like hypertension or diabetes, because hypertension, you check your blood pressure, it's high, well, you have high blood pressure. Diabetes, you check your blood sugar, it's high, easy, you have diabetes. It's not the same with lupus. There's not one blood test that makes me say, okay, this person has lupus, but it's multiple different things that, the physician has to put together to say, this person has lupus. So it can't be cured, unfortunately, but it can be controlled. Diet plays a huge role. And again, because, the cause of lupus in each person is so different. There are different mechanisms by which persons develop lupus. There are just different things that different persons have to do to control their disease. Persons find that, maintaining more of a strict diet, gluten-free, maybe more vegan, avoiding alfalfa sprouts, certain things like that, even salts, persons find can cause their lupus to flare or to give problems. Even incorporating a diet, rich in like anti-inflammatory foods. We know sometimes persons who have like a high turmeric in their diet, ginger, garlic, people find that these things help them. Exercising, stress management, whether it's through devotions or meditations or, just doing things that you enjoy, that's very important to keeping lupus flares at a minimum. Limited sun exposure, just sun exposure is known to precipitate lupus. And it makes me wonder, maybe is this one of the reasons why Black persons have, more frequent and more severe disease? Because from the Caribbean and in Africa, the sun is really our best friend. Cigarette smoking cessation is definitely paramount also to help to control lupus. We use medications also, steroids and other medications that suppress the immune system in conjunction with the lifestyle, and close follow-up with a rheumatologist, which is a doctor who specializes in treating diseases of the immune system. These are ways that we use to control lupus and to just keep inflammation in the body at a minimum. Lupus used to be a very fatal disease. People used to die very young, in their 20s, in their 30s, from kidney disease, from heart disease also, because of this, inflammation that's occurring. It can, lead to like heart attacks. They also die from infections because their immune system is so weakened and functioning abnormally. Persons used to have a really high mortality rate. But we find that now, with close follow-up and treatment, 80 to 90% of lupus can expect to live a normal lifespan. What can we do, or how can we support persons with lupus? Even before they get to the point of developing lupus or being diagnosed, we can look out for symptoms now that we're educated in friends and family and refer to a doctor. I always have a story for some things. I actually have a story about this one. I was working at a health center in Portmore in St. Catherine, Jamaica, and this mother brought her young son, I guess 8-year-old, just for his regular asthma checkup, just to fill his asthma medications, and she brought along with her daughter. She looks like about 5 or even 4 at the time. The daughter just came along just because I suppose the mother couldn't leave her at home alone, so it was really the son that came to see the doctor. When I was finished with the son, I looked at the doctor's face and I said, I can't help but notice there's a little spot right here on her cheek. And the mother said, I think something bitter recently. And I was like, I don't think so. That kind of looks like lupus to me. Here, what? I know you didn't come to see me today, but I'm going to write you a referral to the Bustamante Children's Hospital. So it's a pediatric hospital just for children. Write you a referral to see the dermatologist there. And that was in 2017. And in 2019, when I was working at the university hospital, this is 2 years later, I'm in the rheumatology clinic there, and I'm just walking past, going to see my patients, and lo and behold, it was that young girl there. She developed full-blown lupus, and I couldn't help but think, what if she had a delayed diagnosis, if something serious and severe had happened to her before she was under the care of doctors. So it's so important for us to look out for these things and to identify them early so that persons can be monitored early and treated as early as possible so that we can avoid the life-threatening complications of lupus. Other things that we can do is that we can be a helping hand. Lupus is an invisible disease. Persons, they wake up in the morning and they just don't feel like getting out of bed. They're extremely fatigued. It's not something that we can see, but we can be a helping hand. Just understand, that they may be just struggling with chronic fatigue or chronic pain. That many persons with lupus are just constantly have a baseline pain that they live with, so we can be a helping hand. There's sometimes disabilities, that can happen as a result of lupus, so we can be a helping hand. We can also encourage persons that we know to join support groups. There's a Lupus Foundation of Jamaica, the Lupus Foundation of America, which has chapters in every state. The Lupus Foundation of Jamaica, benefits of that are that you're in a network or an environment with persons who have a similar disease with you. Persons can understand you can relate to each other. I know the Lupus Foundation of Jamaica has a 24-hour hotline that you can call if you need any assistance. And, if there's any mental problems going on, you can call the hotline. They have a psychologist also working with the Lupus Foundation of Jamaica that you can book appointments with. There are subsidies in terms of getting medications with the Lupus Foundation of Jamaica. You have direct contact with rheumatologists by virtue of just being involved with the Lupus Foundation of Jamaica. So these are things that we can do to support or to help persons that live with lupus.
Well, thank you, Dr. Wright. That was a wealth of information. Greatly appreciated. He is someone that I know is big on educating patients and making sure that you're aware of what you need to know and the questions that you can ask and should be asking and should be following up with your physicians. So thank you again so much. I appreciate that. And
it was a pleasure.
Really nice having you on it today. I encourage everyone to please subscribe, share, like the Nurse Lisa Douglas channel. Thank you so much again for your time. Have a wonderful rest of the Saturday. It's beautiful here in New York, New Jersey. We have a beautiful weather, and we're going to try to go out and try to enjoy some of that. Have a blessed evening.